Guide to the graphic. Here we see damage to the heart that can occur with myocardial infarction. Here we have a rupture of the left ventricular wall. Here we have a rupture of the papillary muscle controlling the mitral valve, with retrograde blood flow from the left ventricle into the left atria. And here we have a rupture of the septum between the left ventricle and the right ventricle, with blood flowing from the high pressure left ventricle into the lower pressure right ventricle. Surgery for complications of myocardial infarction. When the left ventricular free wall, papillary muscle, or interventricular septum ruptures following an acute myocardial infarction, mortality is very high unless surgical repair is promptly undertaken. Left ventricular free wall rupture. This type of rupture occurs in 1 to 3% of all patients with a myocardial infarction and is more common in the elderly. Such ruptures are also more common in women and in those with first infarcts. Usually, the rupture occurs abruptly and unexpectedly so that emergency surgery is not feasible. Rarely, a subacute rupture occurs, causing cardiovascular collapse. The patient presents with signs of cardiac tamponade. In such a patient, emergency cardiac surgery, perhaps after rapid stabilization with pericardiocentesis, volume expansion, intra-aortic balloon pump placement, and other medical therapy, offers hope for survival. Papillary muscle rupture. Post-infarction rupture of a papillary muscle with resulting severe mitral regurgitation is more common in the elderly. At the Mayo Clinic, the average age of 22 patients undergoing surgery for this condition was 68 years. In all but 3 cases, surgery was performed within 3 weeks of the myocardial infarction, and the overall operative mortality rate was 27%. Short-term and long-term mortality was slightly higher in patients with an ejection fraction of less than 45%. But age was not a predictor of survival. Patients with papillary muscle rupture and severe mitral regurgitation should undergo surgery promptly because they may deteriorate rapidly and surgery generally has good results. Age should not be a major consideration. Ventricular septum rupture. The results of surgery for rupture of the ventricular septum are somewhat less encouraging. A Mayo Clinic series of 77 patients with post-infarction septal rupture seen between 1965 and 1991 had an average age of 68 years. Among patients with cardiogenic shock, only the group that underwent prompt surgical repair included survivors. And even in this group, the mortality rate was 62%. Among patients with heart failure, about 50% of those undergoing surgery survived. But none of the patients treated medically lived longer than 30 days. Age was found to be an independent predictor of survival. Prompt surgery is advised for most patients with post-infarction rupture of the ventricular septum. And that's surgery for complications of myocardial infarction.